be affordable. And that's why we need to pass my Affordability is Access Act, which I will be reintroducing next week with my friend, Representative Ayanna Pressley, and so many of my Senate colleagues. Now, once the FDA determines an over-the-counter option to be safe and effective for use without a prescription, it should be approved without delay and must be fully covered by insurance, just like all the other FDA-approved birth control. And that's exactly what my bill will do. Women already face so many barriers to controlling their reproductive lives and futures, so we have to be doing everything possible that we can to make it easier to access and afford birth control. With that, I'm going to turn it over to Dana Singheiser. Is Pressley here yet? No. Okay, so Dana Singheiser will be going next.
Thank you, Senator. Thank you, Senator Murray, and thank you for organizing us today, but more so, thank you for always being a tireless advocate for expanding reproductive health for women across the country. My name is Dana Singheiser. I'm a co-founder of the Contraceptive Access Initiative, a nonprofit dedicated to increasing oral contraception over the counter. I'm also a board member of Planned Parenthood of Metro Washington. We applaud the FDA Advisory Committee, comprised of experts and practitioners, for following the scientific evidence and unanimously recommending the first oral contraceptive pill be available over the counter without the medically unnecessary prescription barrier. The committee's vote, after nearly 2 days of scrutiny and deliberations, was unanimous and unequivocal. These experts recognize the overwhelming evidence that the pill OTC is safe, effective, and women can use it without a doctor. The committee's thorough examination and unanimous support leaves no doubt that this product is appropriate for over-the-counter use. The FDA staff clearly expressed their commitment to contraception and the urgency of the moment. However, their framework for evaluating over-the-counter status for the pill was out of step with the science and the particularities of reproductive health products. It's a double standard for such products that unfortunately we have seen before. The experts resoundingly rejected the premise of much of the FDA's evaluation, including anything that would further delay getting the pill on store shelves. We hope that the FDA will respond to the panelists' unanimous recommendation and move swiftly to approve so that we can see Opill on the shelves this year. Of course, our work will not be done even then, and we urge the FDA to revise their approach so that the second pill application can be expedited. We also applaud Senator Murray and Congresswoman Pressley for their leadership in making sure that contraception obtained without a prescription are covered by insurance, just as they are when obtained with a prescription. We are in an unprecedented reproductive health crisis, and making the birth control pill available on a mass scale is an important and urgent advancement. People need more access to the most reliable forms of contraception to prevent unplanned pregnancy. The public health benefit of this approval is unassailable. Finally, we know that the people who would most benefit from OTC availability are those with the least access to care. People in rural areas, people with low incomes, and people of color. Think about what it would mean for consumers to be able to go to the family planning aisle at the CVS or the Rite Aid or the dollar store and get the pill without needing to arrange childcare and take off work to see a healthcare provider. The double standard of an unnecessary doctor's visit makes no sense and is clearly reflective of societal bias. We urge the FDA to follow the scientific evidence, honor the deliberate assessment from a committee of 17 experts, and move swiftly to approve Opill for over-the-counter use for all. Thank you very much, and I welcome Congresswoman Pressley. Thank you for being here.
Thank you, Dana. Thank you, Senator Murray, and all of our advocates for your partnership in the fight for bodily autonomy at a time when this far-right Supreme Court and anti-choice legislatures across our country are stopping at nothing to attack our reproductive freedom. It's imperative that we use every tool available to protect reproductive health and affirm it as the fundamental human right that it is. And when we say reproductive health care, that includes over-the-counter birth control. Now, let me make it plain. The advisory committee's unanimous recommendation that the FDA make birth control available over the counter is historic. It will be life-changing for millions, and it represents a major step forward in our fight to affirm folks' fundamental right to bodily autonomy. Our work certainly doesn't stop here, but we know that birth control plays a critical role in supporting people as they exercise their reproductive freedom and their power. The power to protect one's health, the power to plan if and when and how to start or grow a family, the power to determine one's future and thrive free from coercion and interference. So we applaud this unanimous recommendation, and we urge the FDA to follow the science, trust the experts, and to move swiftly to make birth control available over the counter without delay. And their decision could not come soon enough. Not for the millions of people in America who still struggle to access contraceptive services, particularly our Black, Brown, Indigenous, low-income, disabled, and our immigrant neighbors. It's imperative that we ensure birth control is not only available over the counter, but also affordable and accessible to everyone who needs it. I am so proud to co-lead legislation with Senator Murray and our colleagues that would do just that. So I thank our colleagues and our movement partners for being here today to take stock of this important victory and speak plainly about the work that remains. Reproductive rights are human rights, and we won't let up. And now we'll hear from Victoria Nichols.
Thank you so much. Hello everyone, good afternoon. My name is Victoria Nichols and I serve as the project director for Free the Pill, a coalition-driven campaign to educate and engage the public in support of over-the-counter birth control pills in the United States. Yesterday, in a historic step forward for reproductive health, a joint FDA advisory committee voted in favor of moving a progestin-only birth control pill over the counter. This is a significant milestone that comes after nearly 2 decades of advocacy and research by reproductive health, rights, and justice organizations and advocates. The Joint Advisory Committee's vote is backed by decades of science, showing that birth control pills are safe and effective and appropriate for over-the-counter use for people of all ages. Removing the prescription requirement will mean that more people can get contraceptive care that they need, especially those who face unjust barriers to access due to systemic inequities in our healthcare system. We stand here today. The days for the current prescription requirement are numbered. I urge the FDA to follow the committee's recommendation and approve the over-the-counter progestin-only birth control pill without any further delay. Every day we wait is another day longer where barriers remain in place, preventing people from getting the access to contraceptive care that they want and need. Thank you so much, and I pass it along to Robin.
Free the pill. Good afternoon, and thank you, Senator Murray and Representative Presley and all of the congressional champions for over-the-counter birth control pill access. My name is Robin Watkins. I'm a certified nurse midwife and women's health nurse practitioner and the Senior Director of Healthcare at Power to Decide, a national nonprofit working to advance reproductive well-being for all. We are encouraged by the unanimous vote from the FDA's advisory committee to follow the science and recommend approval of Opill for over-the-counter non-prescription use. Access to Opill over-the-counter without an age restriction would be a major breakthrough in improving equitable access to this safe and effective birth control option. Research from Power to Decide shows that more than 19 million women live in contraceptive deserts, counties where they lack reasonable access to contraceptive method from a provider. We know people living in contraceptive deserts are more likely to be people of color and those living in rural communities. And those folks face systemic inequities in access to health care. When you live in a contraceptive desert, just to get to your appointment, you'll need to travel further, take more time off of work, and arrange additional childcare. However, counties considered to be contraceptive deserts typically have pharmacies or other retail locations where Opill could be available, substantially improving access in those areas. FDA approval without an age restriction could also help address the unique access barriers that young people face. As a healthcare provider who works with young people, I know that my patients can read the label and follow the instructions to correctly and consistently use the pill to prevent pregnancy without talking to me. Additionally, studies show that people of all ages still want to see their healthcare providers, even when they're getting their birth control pills over the counter. And healthcare providers like me and the professional organizations that represent us support the move of birth control pills over the counter without a prescription. We urge the FDA to follow the unanimous recommendation of its own expert advisory committee and approve Opill for over-the-counter use without an age restriction to improve access for those who struggle the most to access birth control. And we call on Congress to pass the Affordability is Access Act so that all over-the-counter birth control is covered by insurance without the unnecessary barrier of a prescription. Thank you, and I'll now turn it back over to Senator Murray. Thank you.
So much. Thank you, all of you. Thank you so much to all of you, and we're happy to answer any questions. Okay, without questions, let me just say this. Over 100 countries, women have been using the pill for over 6 decades. It's time to free the pill and allow women access to this important medication. Thank you.
Why don't we do one big coalition photo, then let's do a video. We all say free the pill. Okay?
You want to do this photo? Can we squeeze in just a tiny bit?
Yes. Can I borrow one of your slides? Oh, of course. Okay. All right.
Beautiful. Look this way just a sec. Alright, and then what do we say?
Free the pill.
Free the pill.
Okay, I'll count it down. Okay. All right, who's recording? Okay, all right. So 3, 2, 1.
Free the pill!
One more time.
Okay. Okay. Should we be joyous or like demanding?
Yeah, do like a chant, like free
the pill. Okay. All right. Okay. All right. 3. We're gonna be demanding. Okay. 3, 2, 1.
Free the pill!
Beautiful.
Thank
Thanks, everyone.
Got a number of constituents in the house. Ayana, nice to meet you. Thank you for being here. Hi. How are you doing?
Volunteer with Planned Parenthood. The first time I got my lobbying career.
It's okay to stay there, right?